Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this cool, crisp winter morning. Oh, wait a minute. It's spring. Doesn't feel like it, but it is spring, and we'll get some more warmth soon enough. Today, we have a great conversation. Of course, we have Hawkeye here, but we also have some Girl Scouts. Pretty cool stuff here. Girl Scout Troop 921 at St. Elizabeth Parish in Waldo, with girls who are both from Kansas and Missouri as our guests, because they took on a special project to earn a badge. We think you're going to like their story. You're going to learn more about it in just a minute. But first, Hawkeye, how are we doing?
You know, slightly better. I'll say slightly.
Yeah, slightly.
Yeah.
I think you're optimistic.
I think at one point we were up to 27 active infections. Right now we have 24 active infections with 9 in the ICU, 5 on the ventilator, still 10 in that recovery period, and Hays has 2 active infections. We haven't had a death since May 4th.
Right.
Though, so that's good.
Yeah, that's good. Yeah. But we're kind of bumping now in these mid-20s. This seems to be a new landing place, isn't it?
Not the best.
No, not the best. I liked when we were at 7 or 8.
Yeah.
So what do you think? You think the numbers are going to kind of creep up as the mask mandates go away? I was at a restaurant this week, pretty packed. I kind of looked around. Fortunately, there were a couple of seats at the bar that were far away from everybody, so my wife and I went there. But, I mean, other than that, it was pretty darn full there.
I'm hoping vaccine acceptance is going to continue to permeate, especially in that population that has been reluctant to get it, especially in that younger population, that 50 and under, who may have had COVID before, maybe not been as sick, really don't think if they get it again it's going to be a problem. Again, we still don't know the full effect of what happens if you do get it a second time, especially now with the variants circulating. We know that the data is really pretty good and clear that there is good protection from the variants with the vaccinations as well. So.
It does really work. And the other good news is it looks like Pfizer is going to go to the FDA this week in order to get fully approved. It's going to take a few months for that to happen, but that should also give folks more confidence about it. And to their credit, Pfizer's been pretty transparent with their data, as is Moderna. Looks like they're going to go in here in May as well. So that's really good news.
Yeah, and hopefully getting the children vaccinated too, especially as we can hopefully move forward and keep schools open in the coming fall.
The Israeli data says they've vaccinated 60 to 70% of their population, and really mostly with Pfizer and Pfizer. I'm going to say Pfizer BioNTech, but with a lot of Pfizer. And man, those folks have done great, and without a lot of side effects. That gives me a lot of optimism that maybe we can convince people in the U.S. that really it is time to be vaccinated. What do you think?
Yeah, I mean, I would totally agree. And now with Dr. Fauci coming out and saying, you know, likely there's going to be a stepwise progression to reducing mask mandates. And in that case, you really, again, need to protect yourself because you don't know who may or may not be vaccinated, even in that indoor space, even though masks are not being worn. So it would behoove you to kind of protect yourself and, like I said, your bubble, the people that you know, and really get everyone vaccinated.
You know, we continue to build this airplane while we fly it, but it's got a lot more parts than it did when we first started this program. Back then, I think we were hang gliding. Right. I'm not sure we're going to hang ourselves or not. But, you know, I think that now, even Fauci over the weekend was talking about beginning to back off indoors if you're in a community, big if you're in a community, and when I say back off indoors, I meant with mask mandates and spacing, if you're in a community that's been well vaccinated. Now, we're already opened. I'm a little nervous about every bit of us being a little real open. I'm a little nervous the numbers may rise, especially because we know that this long haul syndrome can get you, whether you're asymptomatic or fully symptomatic, you may get long haul syndrome, and it's not related to how sick you were. So that's a concern. And the long haul patients we've talked to, it's been pretty brutal.
Yeah, no, and I gave a lecture on this Thursday, and even for our clinic, since the inception of the clinic, that multidisciplinary clinic where we have pulmonology, cardiovascular medicine, neurology, physical medicine, and rehab, we've had almost 200 unique patients come in, with at least 20% of those needing one or more specialists to see. And up through June, we actually have another, I believe, 250 appointments that are made for our long-haul clinic. So it does take its toll. It does affect, you know, up to a third of the people. And you're not just seeing one other specialist. It could be 2, 3, 4 other specialists at some time for those symptoms that you're continuing to have.
Yeah, so this has been a tough time, and I think we all have to recognize that COVID-19 continues to take a toll, and it's better to be safe than it is to be sick. Let's see if there are any reporter questions out there.
Good morning, Cody Holyoke with
Hi,
Channel
Cody.
9.
How are you?
Cody.
Hey, I'm doing all right. Happy Monday.
Happy.
You guys just talked about Dr. Fauci's comments, and I know the White House COVID response coordinator was saying that we're starting to turn a corner when it comes to the virus. But I imagine that, and correct me if I'm wrong, this hinges on more vaccinations.
It does, Cody,
Yeah.
and I think 2 points. First of all, it not only hinges on more vaccinations here, but really throughout the world.
Yeah.
Here's the problem. We can't really live in a bubble. And so in Africa, the vaccination rates are 2 or 3%. In many countries, they're considerably behind those in the U.S. or certainly behind those in Israel. The problem we run into is the virus is not behind. And as those viruses get into places like India, where the population was not very well vaccinated, and then you have a variant, it can still reproduce. It can still then, as it gets into people, mutate. And as it gets into mutate, there's more variants, and then we have to worry more about it. So the current vaccination rate across the world is too slow. And I think increasingly we're getting concerned that COVID-19 is going to be here for a long time, Hawk, and what we're going to have to do is minimize the damage. The only way to minimize that damage is to get folks vaccinated.
Yeah, and you're only as strong as your weakest link, and we know that other countries are suffering greatly, much more than we are or have here in the United States. We have that ability for us, for our community, our United States community, to get vaccinated as much as possible. We have a very good supply of vaccines. Once we can use those, we can also get those to those other places where countries are suffering and having capacities, because it does affect us. And we see that in our supply chains, microchips, the ability to transport gas and lumber. We see that on a real everyday basis, and it will only get worse. So the only thing that we can do is continue to encourage uptake of vaccines within our country, and then also get those vaccines into those people, into those countries that are around the world as well.
Yeah, so I think it is a concern. And I think when Fauci talked about it, when the White House, who was a little more circumspect perhaps than Fauci, said, yeah, we're optimistic, but. And then the but is all about vaccination. And I think what we'll see is people get vaccinated and the variants are out there and there's still disease and there's still widespread community transmission. My guess is that there's going to feel more pressure on all of us to become vaccinated. And as the vaccines are approved, then I think people will get more comfortable with it. The vaccinations really are safe. If you look at what's happened with Moderna and Pfizer, millions and millions and millions of people have now been vaccinated. And they're doing great. And the disease transmission is down remarkably. You may still get COVID. It's kind of a little like the flu vaccine. You can get flu even after the vaccine, but you generally aren't going to get as sick. And with COVID, our numbers drop like a rock. And our vaccinated patients, those who we've seen that we know are vaccinated, we're just not admitting those unless they're here for another reason and we just happen to detect COVID-19 on their admission screen. But they're not symptomatic, which is great news.
Yeah, and we saw last week, I think out of our high teens or low 20s number of that were acute infections, we had one that was fully vaccinated. So we know it does protect you. And again, who are we not seeing in the hospital? It's those patients that are 70 plus years old, 80 plus years old in the nursing homes. We're not seeing those in the hospital. We're not seeing those patients in our ICUs, and that's because there was a great program initially to get those people vaccinated.
And I think the other thing we should do is we'll bring back our numbers. Let's take another survey this week and see how we're doing on those who've been vaccinated and those who haven't, because it's very clear so far that everybody's been vaccinated, not so sick. Those who aren't vaccinated, they're still coming in the hospital. Other questions?
Hi, guys. Good morning. It's Taylor Himness at 41.
Hey, Taylor.
Taylor.
One of the aspects of vaccine hesitancy that I think we're hearing a little bit more about, including on cable news, unfortunately, is that slippery slope dynamic of when does it end? If I get this vaccine, does that mean I have to get another and another and another? Can you address a little bit about what we know about moving forward? What other vaccines are going to be necessary? How often we think, even if it's just conversations about, this is probably going to have to be a yearly one for a little while. The aspect of what vaccinations we face in the future because of COVID, not just right now.
Taylor, thank you for asking that. So I think it's pretty clear that we're going to have booster shots, and I think it's probably going to be annual. Now, if there's a really serious variant that's not protected, you might have to get that earlier. Pfizer and Moderna, I know Moderna has released preliminary data about one of their new shots and how effective it is against the most serious of the variant, the 351 from the South African variant. And but on the other hand, the vaccines still look really good against that. They just fine-tuned it a little better. So I suspect that the next time, that whenever you do get a booster, you're probably going to get the booster with the new formulation in it, Hawkeye. And I think that that's probably going to be annually. It could be every 6 months if we need to, because the variants are so significant. But at least right now, I'm going to bet it's going to be annual.
Yeah, and so far what we're seeing again is we still have very good protection from the current vaccines against these variants, including the South African variant and the Brazil variant. But I think we can boost that efficacy and that immune response with a variant vaccine. And I was kind of just thinking about this on my run this weekend. Should I wait and get my kids vaccinated with the booster or the pivoted vaccine with the 351 variant spike in it, or get them vaccinated as soon as it's available? Probably go with as soon as it's available, just because we also have seen data saying that these current vaccines do have efficacy, and then of course get them the boost when it is available.
And I would just remind us, you have to get a DPT booster occasionally. You have to get other boosters, and I'm going to bet it's a year. I don't think we really know for sure. There have been some people said it's every 6 months, and some people said maybe even longer than a year, because the immunity from that boost, that two-shot regimen appears to last very, very long. We have more data still to look at on the Janssen vaccine, or what's also known as J&J, so I'm not sure about that as much yet, but I'm pretty confident that we're at least, I'm going to bet it's a year on the Pfizer and Moderna.
Yeah, I really don't anticipate anything more than a year. I mean, then you have to identify what is a variant of concern, see how prevalent it is, and then, make that pivot in your production process of the vaccine. So I would really not anticipate anything before a year.
I think it's unclear if it's going to be a one-shot or two-shot regimen for that booster. I think a lot of it depends on how many variants are out there, and whether you have to reacquaint your immune system or you have to prime it altogether.
Yeah, and that we know that there are conserved areas on that spike as well, and you do make an immune response to that. So maybe just getting that, after you've done your initial 2-dose regimen with Moderna and Pfizer, are you going to need just one of that booster shot, or will you need another one maybe 3 or 4 weeks later? I don't think it's clear evident. Hopefully you can just get that one booster, though.
Yeah, I'm going to bet that's how we go.
So, we'll see.
I think that, again, the more people we get vaccinated, the safer we make it for everybody. Remember, the vaccine not just keeps you safe, it keeps everybody safe, and that's really the reason to do it, and it's clearly safe. It is safe, it keeps you safe, and it keeps others safe. So safe, safe, safe. That's what we like, the triple safe.
Yeah, and I think there's more and more information coming out about, number one, immunocompromised people. So more information coming out that people who have solid organ transplants, if they've needed a kidney or a liver, when they're on that immune suppressive regimen, they don't react as well, and up to 30% or more people will not mount that antibody response. There's also new published data about people who have autoimmune diseases, and they are on immunosuppressive regimens as well. Their propensity, their chance of getting COVID is higher, and their chance of risk of severe disease is higher. So we know that those people are out in our community, and we probably interact with them every day. People with autoimmune diseases or solid organ transplants. So it is protection of the community as well, because we need to keep those people well also.
Other questions? All right. Let's introduce our scouts. First of all, we have, I'm going to go through the names, Reagan Hawes-Keener and Mary Jane Van Dyke. Welcome to both of you girls. How are you today? Can you talk? Well, say something tell us about your project. Well, there you are.
Hi.
Good morning. I was waiting to hear that. Hello. Good morning, Kansas City. Good morning, Reagan and Mary Jane. Okay, which of y'all is Reagan?
I'm Reagan.
Okay, so Reagan wears red. Got it. Excellent. And which one of you then is Mary Jane?
Me.
I guess that had to be true, didn't it? All right, well done. So tell us a little bit about your project and why you decided to create a public service announcement.
So we decided to do the public service announcement because we thought it would be a fun way to get the word out that even after you get your vaccine, you should still wear your mask and keep other people safe from COVID. And yes.
I like that yes at the end. That is very good. Keep other people safe from yes. I'm sorry. Go ahead, Reagan.
And also, we decided to create a PSA because our choices were either a PSA or a poster. And so the poster is only in one place, but the PSA can be seen really anywhere on YouTube.
Oh, that's awesome. I do like this. So the two of you know each other. Are you friends?
Yes.
We're really good friends.
You're really good friends. Okay, so is that why you guys y'all in the same room together? So I'm assuming are you guys in the same room there?
Yes.
It's kind of early for you, isn't it? You had to get up pretty early to do this.
No, not really, because we have to go to school every morning.
Well, wait a minute. Are you skipping school to do this? Is that what I hear you saying?
Yes.
Awesome. Can I come skip too?
That's right.
Yeah, we're ready. All right. So where did you all learn that masking is important?
I learned it from my mom
Uh,
because she works with a bunch of doctors. So, yeah.
but
I
some
learned
goofy
it
doctors.
from my family and my teachers because they taught me that it would be important so that we don't get sick and don't get other people sick.
Man, you guys have been well taught. Congratulations to your teachers and to your mothers, because that's awesome. Were you all nice to your moms yesterday?
Yes.
What was yesterday? I forgot.
Mother's Day.
Oh, yeah, Mother's Day. That's right. Well, I'm glad you were nice. Are you nice to your moms every day?
I
Most of the
try
time.
to be.
Sometimes and try to be. Awesome. All right. So why do you think it's easier for school-aged children to wear a mask than adults? Or do you think that's true, that kids do better than adults?
I do because children, they were just brought, so they're more flexible because they have not done anything in their life, so they're not really used to anything. But adults, they've done basically the same thing their entire life, and they've never even seen a mask before.
Well, that's a pretty cool deal. What were you going to say there, Mary Jane?
Oh, never mind. I
Never
forgot
mind.
what it is.
You can say anything you want. I don't mind. I've had kids. I get it. All right. So I think we have your scout leader on with us, Annie Red. Did I say that right?
Yes.
Yes, you did.
Awesome. Annie, how do you know these two young ladies?
Well, myself and my co-leader, Jill Weidrich, have been working with the girls since kindergarten. So we've been their troop leaders for many years now. And they're lovely girls, and we have 24 girls, and they're all amazing young women. And that's what we're trying to help them become, is amazing young leaders and women.
That's the best. Do you think they're really nice to their moms all the time, or do you think it was more like they said sometimes?
Well, I have a girl in this troop as well, so I think I know the truth. So they try.
I'm getting the kind of sometimes signal like that. So what's the truth? Sometimes, all the time? What do you think?
Yeah, I do most of the time. I have them in meetings on a regular basis, and they are all very wonderful girls, and they are full of ideas. I will tell you that. So
The best. I love ideas. That's a lot of fun, and being around kids keeps you young. So I have a couple questions for you. So tell us about the badge these scouts earned and how the public service announcement they helped put together on mask wearing fits that criteria.
yeah, so it's actually called a Bronze Award, and it is the third highest award that a Girl Scout can earn. And it's more than a one and done. You know, a lot of the service projects start out as, simple, how do you help your communities? And this is a more complicated, complex situation. So the girls had to identify a scenario that they felt was an issue that they saw in the community, problem that they could tackle. So they identify the problem, and then they also have to come up with a solution of like, well, how are we going to address this? And then beyond that, they have to attempt to make it sustainable, something that will, go on beyond the one time period that they're working on the project. So it truly impacts the community on an ongoing basis. And then it really has to be complex enough that the girls are spending at least 20 hours on the project. So you've got 11 and 12-year-old girls coming up with a pretty complex project and then spending a considerable amount of time on it outside of their school day and their extracurricular activities.
Well, that's a pretty big deal. If that's bronze, I want to know what gold looks like, because they did pretty well.
We're not there yet. I have no idea.
So girls, did you spend a lot of time on this project?
Yes, we spent a lot of time on this.
I think you have affirmation there, Troop Leader Reed, because it sounds like they felt like they were working pretty hard on this. So did you like doing it, though?
Yes.
Did it give you an excuse for the two of you to hang out together?
It's always nice to have an excuse.
Well, you know, and there you go. I'm all about that. You know, I like to go out fly fish with my buddies, and you know, Bill Linscott, I don't know if you're out there, but man, I'm ready to go sometime. So you got to have an excuse. Maybe we can come up with a public service announcement about how to wear a mask during fly fishing trips. What do you think?
Yeah, I think we can. I think I have another. We can commission them for another PSA.
I like that idea. We should get them to do that. So, ladies, when you get the chance, hopefully you'll get the chance very soon. And by the way, what grade are y'all in at 11 and 12? What grade is that?
5th grade.
5th grade. You're missing a day of 5th grade to be right here, at least an hour of 5th grade to be with us. I think that's okay. What do you think about the vaccine, though? That may be coming your way soon.
Mm-hmm.
I think it's good because then we won't have to wear our masks very much anymore.
Oh,
We'll
man,
still
I'm
have to
all...
wear them.
Well,
right?
yeah, we'll still have to wear them, but we might, after everyone gets it, we won't have to.
I think it's nice because one of my best friends, she is allergic to peanuts, so they don't know if she's going to be able to get the vaccine or not. So as long as everyone else has the vaccine, she's kind of already protected by everyone else.
You know, y'all, I think you guys speak in truth here. This is the best. You've got it. Well
Great
done.
insight, yeah.
I can't wait to see the public service announcement. For those of you who are a part of this program or listening right now, we're going to show you that public service announcement. It's going to be toward the end of the show, so you'll see their whole thing. But man, you guys are you're right on target here. I think you all are direct descendants of Anthony Fauci, I believe. That's awesome. Well done. Troop leader, our scout leader, Annie Red. God, I keep saying Reed because I want to say Reed Red. So anything else you want to tell us about your troop and about what these young ladies have done?
Well, this is actually, the PSA is one portion of our project because we have 24 girls in our troop. That's a lot of girls. And so they came up with the theme of caring during COVID, and then they kind of had 3 different sub-projects. And the PSA being one. They also had the insight to think about other people who were suffering during COVID outside of themselves. And so they're writing letters to folks in nursing home. They came up with these prayer baskets to connect people who are isolated in our community and within the parish that the school is in. So I was really proud of them for thinking outside of themselves, and then the longevity and the impact of the PSA and why wearing the mask is so important, and that it's got to go beyond when people get vaccines, because it's not a black and white deadline of when we get to stop wearing masks.
Yeah, indeed. So it sounds like you guys are right on target. This is awesome. Let's turn to Jill here and ask and see if there's any questions out there from the community. But don't worry, I got some more questions for the 3 of you, so don't you be going anywhere. You have to stay out of school for a little longer.
We do have a few questions.
Awesome.
I'm going to start with Maggie. She wanted to know earlier in the program or the update this morning, you guys mentioned that a person was hospitalized who had been fully vaccinated, and they were just curious if they had comorbidities.
Yeah, we can't say too much, obviously, but that patient was somebody who was sick, and you know, the more comorbidities you have, Hawk, sometimes you don't respond quite as well to the vaccination. That's true for any vaccination, just not just COVID-19. But I think that they're on the road to making a recovery. So
yeah, and we'll try to figure that out too. You know, we aren't putting too much of the health information in there really, and so I don't know about the insight. Again, I think it was a mid-60s person who'd been vaccinated. I believe there were other comorbidities there.
So still very young, I want to point out, when you're in your 60s.
Yeah, absolutely.
And Camilla, she'd like to know, being a transplant patient, questions are coming in and my phone just moved, sorry. Being a transplant recipient, I heard the vaccine may not work on us. Is that true?
Well, I think the jury's out. I think it will still work. It may not be as effective.
Yeah.
And we know you're going to. You clearly, you need to make sure if you're doing the Pfizer Moderna, you get the 2-shot regimen. Talk closely with your transplant centers because they're going to have some direct information. Lots of work being done out here. There's some people are asking, should you get a 3rd shot or a 4th shot to make sure you've really primed your system. And I think all those things may be possible. We'll just have to watch and watch this field develop a little bit more.
Yeah, and then the study is looking across transplant organs from heart, lung, kidney, pancreas, liver. It does look like up to 30% or maybe more may not mount that antibody response. There are other things as well. They aren't really looking at T-cell responses, which are very important. Your immunosuppressive regimen is very important because there are one or two types of drugs that really confer a greater risk of not mounting a response as well. So talk with your immune or your transplant team, but that is why it's all the more important to continue doing those things that we know help protect you. Masking, distancing, going outdoors to do things rather than indoors. Keep yourself safe right now. The proportion of adults that is vaccinated is very good, but it certainly could be better. We could look to have more protection in the community throughout if more people got vaccinated.
And I know that the Biden administration is setting a goal of 70% by July the 4th, and that would be a pretty awesome thing. I want to see us closer to 80 or 90%. That would be awesome. And it sounds like we have girls. So, ladies, do you think you might want to make a second public service announcement about not just mask wearing, but as vaccination hits your age group? Or can we expect another public service announcement
that's what we
about
need to
vaccination?
commission. Yep.
I don't know. We haven't really talked about that yet. So
hopefully you will be seeing another one, but we can't be sure yet.
Yeah, we can't be 100% sure about
Okay.
Tease it. Yeah, that's good.
I think that's a teaser right there. I think
Build
that means we have to
anticipation.
stay
Yes.
tuned and figure out. So what is your all's favorite show? Is it Star Trek?
it.
No.
Well, I don't know if you can come back now or not. Let's see.
My dad's favorite show is Star Trek, though.
Awesome. Tell your dad I like him. That's right. That's good stuff right there.
Jennifer wants to know, when can we expect kids 12 to 15 to start getting the vaccine?
Ooh, I think really
I
soon.
think imminently.
Yeah,
In the
imminently.
next few weeks at least, I believe.
Yeah, I think Pfizer's going to.
it's moving rapidly.
Yeah, I would guess that here in June, or certainly at the latest July, we're going to have an EUA for young people. I think Pfizer submitted for that.
Yeah.
They've submitted it, right? Or they're going to submit
Yeah,
it.
I think
they did
they're about to submit it.
Yeah, or maybe they just went into
And then
the FDA.
we know it won't take long. Once that submission process is done, we know how hard the ACIP has been working and the FDA has been working to review all that data and provide recommendations.
Yeah, it's going to work, guys. Again, remember, Pfizer, Moderna, and J&J, they are safe vaccines. They make you safe, and they keep others safe. It's the triple safe. You want the triple safe.
Lolis wants to know, is it safe for a fully vaccinated person to go back to the gym since the mask mandate has been dropped?
Yeah, I'm still nervous about the mask mandate being dropped, but that's okay. I guess I've probably lost that battle. But what do you think about the gym again? You're kind of a gym rat. I'm a gym mouse, so.
Yeah, I think, it's all risk versus benefit. I think, definitely go to the gym. I still try to pick times that are less busy. Still have not been able to make it back to any specific classes. Still do feel a little bit weary about that because we know those have been well documented as spreader events. But I think, pick what you want to do, identify, where your gym is, what you think the risk factors are. Try to pick times that may be less busy. You can still wear your mask in the gym. There are still people that do that, so that's important as well. But those are the things that you have to look at when deciding to go back or not. How big is the space? Maybe if you are doing a class where there is a class, how good is the ventilation? All things of that nature.
And just as a thought, I go to classes and they're outside, so I think I feel
That'd be
really
great.
good
Yeah,
about that.
I would feel very good about that.
And inside, do you wear your mask when you're at work?
I do.
Yeah, and so I think I've not been working out inside except in my own home, and I think I'd be a little funny about not having that mask on because there's pretty clear evidence now that indoors 6 feet may not even be enough, and you may need to have that mask on to help prevent that transmission because the virus can hang in, and we know it's aerosolized. So.
Sharon wants to know, are patients who do test positive for COVID-19 post-vaccination experiencing long-haul symptoms even though they weren't sick, or maybe not sick at all from the virus?
That's a good question. I don't know that we know that. And I don't know that we have enough data in those breakthrough infections to really understand that. We hope that you would have less symptoms, a shorter duration of those symptoms, but I don't think that question there's been any data to support. I've seen more stories, at least in the news, about people having a resolution to their long-haul symptoms after vaccination than I have about long-haul symptoms after getting infected after vaccination.
I'm
So
gonna-
I'm sure there will be stuff coming out about
I
that.
think, yeah, we'll see. Well, it's another question where we're building the airplane, but my forecast is the part's going to fit, which means that vaccination is going to help prevent any serious long-haul syndrome, and certainly
that'll
much
be great.
better than those who have. The other thing to remember is there's long-haul syndrome that occurs, 6 or 8 weeks later, and then there are those patients who have permanent lung impairment or brain impairment or heart impairment as a result of COVID-19. That is related to how serious your infection was, and vaccination clearly prevents those.
Carrie wants to know, why don't you talk more about the J&J vaccine anymore?
Oh, it's only because I think Pfizer and Moderna have been in the news more lately, and we're still really confident in the J&J vaccine. I think we still give it and still have great confidence in its ability. It's just Pfizer and Moderna are in the news with these new developments about either pivoting, as you've mentioned, Hawk, going into the FDA with for full approval and other things.
Yeah, and historically, the vaccines that we have been getting here at our health system to give to people has been the Moderna and Pfizer vaccines. There was that pause, so there was a slowdown in the rollout. I still think the Johnson & Johnson, the J&J vaccine, offers benefits that people, they don't want to get at 2 doses. They're concerned about the side effects of the Moderna Pfizer, such as the local injection site pain or maybe fever or fatigue afterward. So I think there still are benefits that people are looking for to get that one shot, that one dose. But it's just like historically we have not been giving it since the rollout, really.
Yeah, and plus the J&J vaccine struggled a little bit more with their production because there's some production issues around it. As it turns out, the mRNA vaccines are pretty easy to produce. It looks like there's going to be a third mRNA vaccine that's going to come and hit the market. I'm going to guess it's going to be in June, and it doesn't require anything more than simple refrigeration. So much easier to distribute to the world. I think the Novavax vaccine will be out then too. So girls, I have another question for you. Have you guys known anybody that's had COVID-19?
Yes. Guess what? I'm the only one in my family who hasn't had it.
My best friend's family and
my parents and my siblings have had it, but I haven't.
How'd they do?
Yeah.
They were fine. The person who had it the worst was my dad. Siblings were fine.
Yeah, my best friend, her entire family got it.
Yeah, that's
She
kind of
was out
scary
for a
though.
long time.
Yeah.
Yeah, it's kind of scary because some people don't do so well with it, huh? Yeah. Okay. Have other people in your troop, do you know if they've had it or any of the other girls there?
I think one girl has had it.
Yeah, I'm pretty sure 1 or 2.
Yeah, 1 or 2.
All right.
I'm not sure which one, but I know one of them has.
Yeah.
So do you guys do a good job washing your hands?
Yes.
Excellent. And show me how you cough. Wow, that's like the best. You could come back on our program anytime. You guys are really good at that. Well done there, huh? Good deal. And if you get sick, do you stay home or do you run out and play with your friends?
Stay home.
Woo! Man, you guys are smoking. Well done. Not really. Don't ever smoke. That's a bad thing. Chill.
Oh, and Sean wanted to know, one of the girls brought up, I think it was Reagan, that she has a friend who's got peanut allergies, and he's curious, can the girl with peanut allergies get a shot?
I think we're okay on that one.
Yeah, actually, people with a history of allergies to any antibiotics or other drugs or food allergies, there's no contraindication right now to getting the vaccine. So, the best guidance is, yes, certainly you can go ahead and get that.
Okay.
Sel wants to know, some schools are considering lifting mask mandates in schools for fall, especially the elementary age kids, but so far only 60% of district staff are vaccinated. Do you think it would be safe to have my kids in-person school with unvaccinated staff not masking?
Oh, man, that's a big question, Hawkeye.
What is it? Right now on May 10th, I'm still saying it's going to be a little bit iffy and worrisome, but we have seen the velocity with which we are able to get people vaccinated. We are able to see decreases overall in cases. Not so much hospitalizations right now. I think it depends what the infection dynamics are in your community and what is the rate that we can get the children with vaccination coverage as well. So I think right now on May 10th, that seems pretty dangerous and risky, but who knows where we're at once we get to August and September.
Here's my answer. I think we don't know yet what this fall looks like, to your point, and I think we're going to need to get a little more time around with us and have a little bit better understanding of what the community spread is like, what the variants are like, and how many people have been vaccinated. I think if you've had 70 or 80% of the people there that have been vaccinated by then, I think it's pretty safe. I think if that's not the case, if let's say you get 20 or 30%, then I think that's more dangerous. Or if you're like the Sutner Academy down in Miami, Florida, or near Miami, Florida, where you say if you've been vaccinated, you can't be a teacher here, well, that's just absurd.
Yeah.
And so it really depends on the infection dynamics, what are the overall policies in your school. And again, we can give you a great medical answer that may not be the same as what a public health official will say or even a school official will say, because they have to weigh all the risks around kids and mental health and things like that. We're just going to talk about physical health. And in our lane, I'll tell you, the more that you're vaccinated, the safer it gets. You want to be, as we said earlier, you want to be triple safe.
Yeah, and I think, to your point, that school in Miami was the absolute 100% wrong and inaccurate message to send based on no scientific evidence or data. But also, I would encourage that those people who work at the schools, I would encourage uptake of the vaccine for them because, okay, they may not get ill or have a high risk to go to the hospital, but they are still going to be missing school if they do contract COVID-19. So you're talking about missed days work and all of that stuff. So again, it's important to really get vaccine uptake by everybody.
Okay. And
You got
then,
one more question? One more?
Yeah, I know the girls have got to get back to school too, so I'm going to combine a question from Carrie and Joe Ellen. Joe Ellen and Gretchen. They're asking about the shots. Joe Ellen wants to know, are you going to be able to get the shot at your primary care doctors anytime soon? Yeah. And Gretchen wants to know, if we have the Pfizer vaccine, do I need to stick with Pfizer?
Two great questions. So from the standpoint of your primary care physician, here at the University of Kansas Health System, primary care physicians have the vaccine. Yeah. Actually, some of the specialty care, I give it in my pulmonary clinic as well, and we try to make sure we give as many as we possibly can every day. We're still not getting as many as we would like vaccinated. But yes, you can now, at least for us, you can get it done in your primary care physician's office. Yeah. And then if you get one, do you stay with one, or do you think you can flip around?
Yeah. Ultimately, I think you can, mix, but right now the guidance is not to mix because of lack of data. I think, again, as we get more vaccines out there and available, and if there are boosters, there probably is going to be just inherent mixing by people going to one place or the other to get it. But right now the guidance is if you got Pfizer for your first dose, get Pfizer for your second dose. In extenuating circumstances, they can switch and give you Moderna. But the same thing, if you got your first dose with Moderna, get your second dose with Moderna. That's the best guidance, and I would stick with the original company or the original vaccination that you got for your first shot.
Yeah, I think that's kind of where I would land as well. So girls, first of all, I want to say thank you to you all. I want to talk for a moment about tomorrow, then we're going to come back to you. Tomorrow, we continue our look at the impact on mental health with Justin Hoover, the Executive Director of The Battle Within. We're going to check back in with Adam Majors as well, Frontline Therapy Network's clinical coordinate. We're going to talk about how patients are screened for services and how mental health professionals are holding up. That'll be a good conversation. These are two terrific people. All right. Let's start with you, Reagan. Do you have any final thoughts you'd like to give us today?
No, not really. I think MJ does, though.
I think you did a great job. Mary Jane, how about you?
I just want to say that even after you have a vaccine, wearing a mask is still important.
Yes, it is. Very important.
I love it. You guys are the best.
Right.
Hawkeye, I think we could be replaced. First of all,
I love their smile.
they have more personality than
Absolutely.
we do. That may not be saying a lot. But second of all, they seem to know a lot about vaccination and infection control.
Yeah, absolutely. I think we need to continue to get some advice and keep them coming on and giving the good message.
Yeah, I think that's great. And third, I think they just seem like good folks here. I think we got to bring them back. Yep. So thanks to you guys and thanks to your parents. All right, Troop Leader Red. I said it right that time, I hope. Annie Red, thank you very much for being on here. Thanks for having such a great troop. Final thoughts that you might have today?
I would just say that it's been a really good project, and the girls have not only helped with the COVID messaging and spreading that within their school system and their families, but they've really learned a lot about the skill set that it takes to be a leader and identify problems, execute, and work with others. So I'm really proud of them. And of course, we hope that the longevity of the message is in the PSA helps add to folks keeping their mask on. I mean, they're pretty stinking cute. So I don't know how you watch the PSA and not wear a mask. So
So we've been able to see bits and pieces of that public
Yeah.
service announcement that Girl Scout Troop 921 has made. We're going to show you the whole video in a minute, just as we say goodbye. We want to say thanks again to these great folks, and we want to say thanks to all of you for being a part of this program. And remember, be triple safe. Get your vaccine, wear your mask, follow the rules of infection control. Until we talk again, there's still no place like home. We'll see you tomorrow.